This is Walker Street Doctors update for Tuesday the 1st of February 2022. With regards to the 5 to 11-year-old COVID vaccinations, we've spoken a lot about the why and the when, but today I'd like to just spend a few minutes on the how. It's an unusual cohort that we're vaccinating here. Their baby vaccines are a thing of the past, where you as the parent consented and took control. They're not quite up to consenting and presenting themselves for their adolescent vaccines. In this age group, it really is a shared consent process. They might like the idea of being vaccinated like their parents, and you can consent on their behalf, but let's face it, you can no longer drag a 10 or 11-year-old in for vaccination against their will. They also need to consent. And 5 to 11-year-olds no doubt have been affected significantly and in a protracted way by this disease. They may not have the language to express their concerns, and they may not have the skills to process their experience terribly well. So when they and you do come in for vaccination, while we're welcoming you in an upbeat way from the waiting room into our surgery for vaccination, we're also watching yours and their body language very closely. Largely, 5 to 11-year-olds fall into three broad groups. The first are the children who walk in ahead of their parent, happy to engage in small talk, often have one sleeve rolled up, ready to go by the time they're actually sitting down, and they give you the look, stop talking already and get on with it. The second are the group who are obviously anxious, holding a parent's hand, walking in behind them, clearly worried about the whole process. They have their understandable anxiety validated by their parent usually, who's supporting them, and the vaccination really has to proceed without delay, putting the child out of their misery. By far the most common group, though, is in the middle of those two. We as clinicians are aware that they almost certainly have had experiences in the last 2 years that they have been unable to process or to express. So when they come into our surgery for their vaccination, we're watching their body language very carefully. Where we take care to spend time to adequately consent an adult prior to vaccination, we're very aware that a prolonged preamble just causes unnecessary anxiety in a child in this age group. If the bottom lip starts to tremble, or the knees start wobbling, or a child's gaze diverts to the door for an exit strategy, or their knuckles are starting to go white on their chair arms, these are our calls to action stations. We'll look to you to provide a comforting bear hug for your child, to make them feel safe and calm and loved. And we'll move in quickly to vaccinate your child and then provide them with the appropriate debrief to follow. Usually what follows the vaccination is a nervous giggle or a few tears or a comment such as, "Have you done it yet?" or "Is that all it is?" And very occasionally we get a parent who does not follow our lead and insists on negotiating with a child who is clearly escalating in their anxiety. If there's only one thing that I've learned in 24 years of general practice, it's this: that you cannot negotiate with the amygdala, the primitive brain. It's a lesson that most parents learn when their first child turns 2, when they have their first temper tantrum. You can't negotiate with a child having a temper tantrum, nor can you negotiate with a child having a meltdown prior to vaccination. In the case of vaccination, you need to hold them tightly, get them vaccinated, at which point the tantrum always stops, and then spend adequate time debriefing with them, pointing out that actually thinking about the needle is actually so much worse than having it, because the needle is pathetically small and painless. The volume of the vaccine is pathetically small and painless. And generally speaking, after that debrief, they're in a much better position to approach the second vaccination than they were with the first. Before leaving this subject completely, please be aware that if you have a medically at-risk child and you'd like to bring the interval between doses forward from 8 weeks to 3 weeks, please let our reception team know. We're often looking to fill the 9th and 10th slots in a day when people pull out because they've become unwell. For adult boosters, It is still very important to get a booster after infection because it'll give long-lasting immunity that the disease does not. The general advice is if you're well 4 weeks after infection, go looking for an appointment in the next fortnight for boosting. And I hope that update has been helpful.